Welcome to Concise Anatomy. Today, we'll break down the thyroid gland into key points. The thyroid gland is the largest endocrine gland in the body, located superficially in the neck, making it easily palpable during examinations. It plays a critical role in regulating basal metabolism and growth, and has the unique ability to store hormones for later release. Did you know it's larger in females and grows even bigger during pregnancy? The thyroid gland is located in the lower neck, positioned over the upper trachea, and spanning from the C5 to T1 vertebrae. Its isthmus lies across the second to fourth tracheal rings, while the lobes extend vertically from the oblique line of the thyroid cartilage down to the sixth tracheal ring. The thyroid gland is H-shaped, consisting of an isthmus and two lobes. Occasionally, a pyramidal lobe extends upward from the isthmus, representing a remnant of embryological development. Each lobe is roughly pyramidal in shape, featuring an apex, a base, three surfaces, and two borders. The thyroid gland is surrounded by two capsules. An inner true capsule, formed by the gland's fibrous stroma. The venous plexus of the thyroid lies deep to its true capsule, allowing surgeons to remove the thyroid gland along with its capsule, significantly minimizing the risk of bleeding. And an outer false capsule, derived from the pretracheal layer of the deep cervical fascia. On the medial side, the false capsule thickens to form the suspensory ligament of Berry, a critical landmark in thyroid surgery due to its close relationship with the recurrent laryngeal nerve. Here's the thyroid gland with its isthmus and two lobes shown from the front, highlighting the anterior and lateral aspects. And here it is from the back, exposing its medial and postural lateral surfaces. Let's now discuss some important anatomical relations of the thyroid gland. The apex of each thyroid lobe is directed upwards, reaching up to the oblique line of the thyroid cartilage. The base can extend down to the fifth or sixth tracheal rings. The lateral surface of the thyroid is convex, covered by the strap muscles, and the anterior edge of the sternocleidomastoid muscle. The medial surface is related to the trachea, esophagus, thyroid, and cricoid cartilages, and the recurrent laryngeal nerve. The posterolateral surface has close relations with the carotid sheath and its contents, including the carotid artery, internal jugular vein, and vagus nerve. Here in this image, you can see the relations of the thyroid gland to the laryngeal skeleton, trachea, and the major neck vessels. The anterior relation of the thyroid isthmus includes the strap muscles and the anterior jugular veins. Posteriorly, the isthmus lies over the second to fourth tracheal rings. This image shows the pathway of the recurrent laryngeal nerve and the superior laryngeal nerves, which are of critical importance in thyroid surgery due to their close proximity to the thyroid gland and the potential risk of injury during the procedure. The recurrent laryngeal nerve runs in the tracheo-esophageal groove, is usually deep to the Berry's ligament, and always lies immediately posterior to the cricothyroid joint. The superior laryngeal nerve divides into the internal and external laryngeal nerves at the level of the hyoid bone, with the external branch descending to supply the cricothyroid muscle. The thyroid gland contains two types of secretory cells. Follicular cells are cuboidal in shape and form the walls of the follicles. These cells are responsible for producing thyroxine. Parafollicular cells, also known as C cells, are located between the follicles. They produce calcitonin hormone controlling the calcium levels in body. The thyroid is usually supplied by two arteries. The superior thyroid artery, a branch of the external carotid artery, and the inferior thyroid artery, which arises from the thyrocervical trunk of the subclavian artery. But in approximately 30% of individuals, the thyroid ioma artery provides additional blood supply originating from the brachiocephalic trunk, or aorta. The venous drainage of the thyroid gland occurs through 3 veins. The superior thyroid vein and middle thyroid vein both drain into the internal jugular vein, while the inferior thyroid vein drains into the left brachiocephalic vein. The middle thyroid vein is identified and ligated at the initial stage of thyroid surgery to prevent major bleeding. The nerve supply to the thyroid gland consists of parasympathetic fibers, which are derived directly from the vagus nerve and via the recurrent laryngeal nerves, and sympathetic fibers, which originate from the superior, middle, and inferior cervical ganglia. The lymphatic drainage of the thyroid gland is classified into 2 groups. The upper group includes the prelaryngeal and upper deep cervical nodes, while the lower group drains into the pretracheal and lower deep cervical nodes. Goiter refers to the enlargement of the thyroid gland, which can occur due to either hyperfunction or hypofunction of the thyroid. Some goiters can grow to a massive size, causing compressive symptoms that require early surgical intervention. These symptoms include dyspnea, caused by pressure on the trachea, dysphagia, resulting from pressure on the esophagus, and dysphonia due to pressure on the recurrent laryngeal nerve. That wraps up our discussion on the thyroid gland. Thanks for watching. Don't forget to like, comment, and subscribe. See you in the next video.